Hello everybody, I'm Rob Wallace. I'm an evolutionary epidemiologist with the People's CDC, here with an update on the COVID-19 pandemic. We begin with the global COVID situation. In the graph in red, the Johns Hopkins Coronavirus Resource Center reports another decline in world COVID to 5.7 million confirmed new cases for the week ending April 17th. That's good news. But that new caseload is still greater than nearly all weeks from the beginning of the pandemic to when the Omicron wave began in late 2021. Clearly, the pandemic isn't over. The number of confirmed global weekly deaths, on the other hand, there in white, are down under 20,000 for the week, the lowest level since April 2020. At the same time, the number of vaccinations administered this week, there in green, is down to 65 million. The lowest since March 2021. Global declines don't mean every country's COVID is disappearing. This New York Times map shows that over the past week, we still have hotspots in Europe, Asia, Australia, and New Zealand, with Canada, Finland, and the UK moving up in average daily cases per 100,000 population. Looking at this time series of daily confirmed COVID cases per million people, the increases in these countries, like Finland here, aren't anywhere near what Hong Kong and South Korea went through this past month, but indicate that despite the overall decline in global caseload, COVID is still very much surging here and there. South Korea's new cases are in decline, but are still accumulating at rates that haven't been seen most elsewhere since the start of the pandemic. Hong Kong's outbreak is continuing to bottom out after its unprecedented spike. Australia is tailing off in its recent outbreak. Germany appears exiting its months-long surge. China's cases per million, despite the Shanghai outbreak, remains flat, as China hosts few cases on a per million population basis. COVID deaths per million population finds the U.S. at its lowest death rate since before the Delta variant arrived stateside last year. But the U.S. is still hosting the greatest number of deaths per day of any country at 433 deaths over a 7-day rolling average. Other places, for instance Hong Kong, see large declines in deaths off their Omicron spike, but still are at levels not seen since last winter anywhere else. Despite only a small increase in cases per population, Finland here has hosted a set of new waves of deaths since the new year, hand in hand with rolling back its COVID control efforts. In the U.S., cases per 100,000 population show Alaska, Colorado, parts of Texas, Illinois, Kentucky, and Virginia, and the Northeast continuing to be hit by circulating COVID. Despite the welcome decline in reported cases overall, parts of the country remain centers of COVID circulation. The data sources on which such maps are based are under threat, however. ABC News reports the Department of Health and Human Services ended the requirement hospitals report daily COVID deaths, overflow in ventilated COVID patients, and critical staffing shortages. Some U.S. states outright ended reporting COVID metrics, hospital bed usage and availability, and ventilator use. Some states scaled back COVID reporting to as delayed a basis as weekly. Some hospitals followed the National Institute of Health's lead, changing definitions of COVID cases, including only to those patients that receive antivirals remdesivir and dexamethasone. Some public health departments replaced state PCR testing with at-home rapid antigen testing, or ended such programs entirely. Unlike other countries, the increases in at-home testing here in the U.S., as this CDC graph shows, whether provided by the state or bought at the store, are accompanied by no requirements to report results to public health departments. Our understanding of where and how much COVID is circulating is becoming fuzzier. One way to get around this issue is to test for levels of SARS-2 in the wastewater that comes through our sewage plants. The CDC compiles these reports here for April 2nd through April 16th. Here we see high levels there in the red in the Bay Area, northern Illinois, New York City, Philadelphia, Atlanta, Miami, and parts of the Northeast. CDC also maps the changes in SARS-2 detected in these plants, showing here in red many sites around the country with increases over 1,000% or more over the 15 days ending April 16th. But it's only a few states that report these data, and for some states, only from a few sites. These data do not offer the kind of fine-grained neighborhood data that effective public health interventions require. Given all these issues, what does the CDC think is the status of the U.S.'s COVID outbreak? In February, the CDC introduced a new measure of alert called community levels based on COVID hospitalizations given the medical capacity available. By this measure, we see that as of April 14th, most of the country is defined as largely out of danger there in the green. The problem is that hospitalization represents a lagging variable that marks a local outbreak later in its cycle. And while a lack of hospital beds might mean those with a dangerous infection may not get the right treatment, a lot of available beds doesn't protect the most vulnerable from COVID's short and long-term effects, including for the immunocompromised, the disabled, elderly, and children under 5 still ineligible for vaccines. CDC's previous warning system was based on actual community transmission. It shows, like the New York Times 7-day map, that as of April 14th, Alaska, Illinois, Virginia, southern Florida, and the entirety of the Northeast register as high in community transmission. The contrast between the two CDC systems is startling. Some areas in green, or low, in the community levels map are shown in the community transmission map to be in red, or high. It's this map that CDC abandoned. Which map to use? The Biden administration indicates it's entirely up to the American people. Every person is now expected to be their own CDC. If you get sick or a family member dies, that's now your responsibility as you didn't come to the right decisions about risk and reaction. Many public health professionals and concerned community members here at the People's CDC and elsewhere think otherwise. If there's any crisis that requires a coordinated response from a federal government and local jurisdictions all the way down to block associations, it is a global pandemic. Cutting each other off from ourselves is not the answer. Our final item today. In March, the Pew Research Center reported results that speak to how COVID's spatial dynamics may have helped set up the U.S.'s political clashes around COVID. In the initial period of the pandemic, it was the densely populated counties that were hit first, largely cities on the east and west coast, and a few hit inland like New Orleans. But in the waves that followed, here particularly the third wave during the vaccine rollout and the Delta variant wave, it was the less populated counties that were hit more, although that evened out a bit during the Omicron surge. The Pew study also showed a similar switch in counties along the lines of how they voted for president in 2020. The counties that were more supportive of Biden in 2020 were hit worse in the initial period of the U.S. outbreak, suffering the larger number of COVID deaths. But by the vaccine rollout, that distinction had switched to the counties that were more supportive of Trump in the 2020 election. This imbalance continued through the Delta and Omicron surges. We need ask whether the imbalances in both directions contributed to the countrywide divide, with the Trump-supportive counties caring little for an outbreak that hadn't hit them in the early pandemic, and the Biden-supportive counties caring less once vaccination started. That's likely an oversimplification of matters, but may serve as a place to start as we move forward finding grounds to end the pandemic together, rather than pretending it will go away by itself, or that we can solve this as individuals. And that's this week's COVID report from the People's CDC. You can learn more about the People's CDC and read this week's COVID weather report at peoplescdc.org.